Hello po, and today is Thursday and it's another day for us, Dr. Ana, sa atin pong libreng konsulta. I'm Dr. Ana York Bondoc. I am an internist and a pulmonary specialist and I will try my best po na sagutin po ng maayos at mabuti. And I hope that it can teach you something yung mga pinadala niyo po today. Again, I would like to explain ano po. Please put your questions down po sa comments and we will do our best na i-pick up po sila in the time limit that we have. Number 2 po, pasensya na po but we cannot give answers specific to your case. Ano? Kasi hindi po namin kayo na-examine but hopefully ma-point po namin kayo sa tamang direksyon and maybe to give you some idea about the condition or the disease po that you are asking us. So tara na po, please put your questions below and let's start. Again, I would like to apologize. We may not be able to flash the questions, but we will definitely read all that we can today. So we are here with Miss Reina, our nurse. Hi, Ma'am Reina. How are
Hello
you?
po, Doc. Yes, we are having technical difficulty lang po today. Babasahin ko na lang po yung question from the poster that we posted earlier po.
Opo, nahiya po kami i-cancel. So go na rin and we're just gonna read the questions. Okay?
Yes.
So please
Ready na
bear
tayo,
with us
Doc?
and hopefully you learn.
Okay.
Question number 1.
From Miss Corazon Bernada Sambo. Doc, ano po ang gamot sa dry mouth? Related po ba ito sa may mga thyroid?
That's a good question, ano? Usually po, dry mouth is taken care of po by dentists. Yung mga dentista po or ENT, ano? It's usually not a problem po that is faced by, like ako, internist, ano? But what I can contribute to po to you is this. It can happen po. Sometimes they ask them to chew chewing gum po o kaya po ano yung mga sour candies to increase po the work of our salivary glands. Kung talaga pong dry mouth, first of all, you should see your dentist kasi po when your mouth is dry, ano, we use our saliva to yung mga pagkain na dadala ng saliva at yung mga dirt and then linulunok actually natin or dinudura. When your mouth is dry, there is more, there's more tooth decay. So you should actually see your dentist. And kung magpe-persist po, maybe you should also see an ENT. A few home remedies nga po is sucking on candies and chewing gum to increase po your salivary output. Okay? So thanks for that. Not many people ask that. Is it related to thyroid? Hindi naman po, as far as I know. But I'm not an endocrinologist. Siguro po, if you do have a thyroid condition, you can ask your endocrinologist. Pero ang alam ko po naman, it's not a prominent symptom.
Okay, next question po.
Opo.
From Miss Michelle Espanola. Doc, good PM po. Nagme-maintenance po ako ng amlodipine, 10 grams. Pero pag tumayo ako para akong nahihilo at parang matutumba. Thanks in advice. Baka 10 mg to na, doktora?
Yeah, 10 milligrams. Ano po? Mom, so you're high blood. So you're taking amlodipine. And every time that you feel like standing po, parang nahihilo kayo. So a good question that I would like to ask po, is ano po yung presyon nyo right now with the amlodipine? Okay? 2 things are possible here. Number 1 po, baka po your blood pressure might be too low. Masyadong mababa. Because maybe you're already sensitive to 10 milligrams kahit hindi naman ho masyadong malaking dose. So try to see po kung ano po yung presyon nyo on amlodipine. Kung mababa na po, then you should talk to your doctor about adjusting po yung dose ng gamot. Number 2 po, there are some side effects po talaga na nakakahilo. And if your blood pressure remains to be high pero nahihilo kayo when you're standing up, that is actually what we call orthostatic hypotension. As you rise po, bumababa bigla yung BP nyo and you feel like fainting. Maybe amlodipine is not the medicine for you. So balikan nyo po si doc, no? Check your BP and then balikan nyo po si doc. And maybe you can tell them that marami na po, no? There's almost 60 kinds of gamots for blood pressure and you can be shifted po to another kind that hindi po kayo nahihilo. But again, do not do this without talking to your doctor. Wag nyo lang biglang itigil yung amlodipine. Go to the doctor's office and say, nahihilo po kayo sa amlodipine. And then they will check your BP, Baka ho paghigain kayo, they'll see kung anong mangyayari when you sit up, and it's possible po na papalitan po nila yung inyong gamot. Okay, thanks. That's a good question. And the point I would like to bring out, kung may adjust po sa blood pressure meds nyo, please do it with the knowledge of the doctor. Don't do it yourself.
Okay, next question from Miss Dayan Dunay Ihong. Good PM po, Doktora. Ano po ang dahilan sa masakit ang likod ko?
Ma'am, marami talagang dahilan kung bakit masakit ang likod. And I hate to say this to you, the number one dahilan is aging. Ano po, habang tumatanda po yung mga tao, we develop po, very common po talaga ang back pain. Ano? One of the things I can tell you talaga is be careful with the way you bend. Huwag pong gaganon, ano? You take it from your legs. Number two po, also rest also. And if it's not getting better, then you need a workup din po.
Next question po from Miss Mean Dabi Fumera. Hello po, Doktora. Hindi po bumababa ang BP ko sa 140 over 100. Ano po kaya ang dahilan? Nagme-maintenance na po ako ng losartan 50 and amlodipine 5 po.
Okay, thanks for that question, Mean. And yes, 140 over 100 remains to be high, ano? But my question is, and I know your gamots, okay? But my question is, where did you start? Baka naman 180 kayo 3 months ago before you started the gamots. So malaki na kung improvement yung 140. But again, ideally po, it should be even lower and at least 130 over 90 or even lower pa po, like 130 over 85. So what should you do now? Let's say, number one, excuse me, check nyo ho talaga that you're drinking the gamots, ha? Kasi I have some patients nagre-reklamo na hindi bumababa yung presyon upon further investigation, patigil-tigil po yung gamot. But if you are really taking the gamots, ano, number two, what to do? Try to lose weight. Even 10 pounds po can make a big difference, lalo na po kung kayo po ay talagang medyo mabigat. Kung talagang payat na po kayo, wala na kayo ibibigay. Number three, consider po the salt in your diet. Ano ba kinakain mo? Are you eating potato chips, bagoong, and putting a lot of toyo and patis in your sausawan? Salt po can really make a big difference po sa inyong pong blood pressure. And number three po, light exercise also. I do believe po that if you start moving, it will really help. Try to also get some rest. Bawasan po yung stress sa buhay nyo. Ang tao pong hindi matutulog na mabuti, mataas din po ang presyon because they cannot rest themselves. Stress is, of course, nakakataas ng presyon. Okay? And if you do all of that po, and it still remains to be high, then maybe we could adjust po again your medication ng konti or possibly po add another medication. Sa mga ganun po, no, this is already a technical question. But if someone is on 2 gamots and they're already maxed out, I would start them on diuretics, Lasix po, what I would suggest. But again, don't just say don't take it because I said so. Ask your doctor po muna. So yun po yung mga tips ko po kung hindi talaga gumagalaw yung presyon nyo despite your gamots. Try to lose weight. Try to exercise in a light manner. Try to get good rest. Try to lessen your stress. And salt intake, big issue.
Okay, next question from Miss Roldan Cebuan. Miss Roldan Cebuan Maylene. Good afternoon. I am 43 years old. Ako po ay nagkaroon ng asthma last September pa po this year. And hindi pa po ako gumagaling sa ubok ko po, Dok. Sa gabi po, hindi po ako makatulog. Hirap po akong paghinga. At the same time, inuubo din po ako till now. Nagpapakonsult po ako sa doctor last October po. Nag-take po ako ng gamot na nireseta niya pero wala pa din po eh. Dami ko na pong nainom na gamot. Doc, help niyo po ako kung ano pong pwede kong inumin na gamot. Thank you po and God bless. May asthma daw po sa Doc.
Yes. Actually, one of the first questions that I'd like to ask is, are you sure you have asthma? Yan ang magandang tanong. Okay? And the other thing is, ano po yung pinainom sa inyong gamot? Because if you do have asthma, Ma'am Maylene, the first step talaga po doon is inhalers. Okay? So, yung marami kang ininom na gamot, that begs me to ask, ano yung diagnosis niyo po talaga? And did something happen po before this happened? Okay, points that I'm bringing up. And I'm an asthma expert. It's my second best sakit. My second favorite sakit after lung CA kasi nga po I'm a pulmo. Asthma is not normally like na-diagnose ka lang. Usually, though some people doon lang na-diagnose, okay, it's possible naman, ano? But usually, it is a long-term problem. And we usually, diagnose this from symptoms, what happened, kung minsan narinig po natin, humuhuni, no? May tunog ang paghinga. Usually, yung paglabas ganon. If your child, your partner, your mom, or whatever, naririnig na po, that really could be asthma. Okay? Assuming na tama po yung inyong diagnosis na asthma. What is the first line treatment of asthma? Two ways po yan. The first is avoidance. Alamin nyo po, if anything is triggering your asthma. Kayo po ba ay hinihika after a viral infection? So, dapat di kayo magkasakit, ano? Kayo po ba ay hinihika from cigarette smoke? If your husband smokes, you have to get out of the house or he has to get out of the house. There are people who get asthma from pollen. There are people na hinihika po from dogs and cats. There are people po na hinihika from exercise. And there are people po na hinihika sa malamig na temperatures. Okay? So these are all things. You need to know this. Ay tingnan nyo po kung ano yung pattern po ng hika nyo and avoidance. Okay? So avoid. Assuming hinika ka na, no? Number 2 po is treatment. What do we start when we have asthma? At bakit po sila may dalang inhaler? And why do they have a nebulizer? Okay? The number 1 treatment po talaga for acute asthma is Ventolin or salbutamol. Ano po? This is a medicine that triggers po yung inyong relaxing the smooth muscles po ng inyong bronchi or baga. So that nagta-tighten po yan in reaction to something, the allergy, the virus, the exercise, the cold air, the pollen. So lumiliit po yung daanan ng hangin natin, the very small ones. And pag ipit po yun, that's what makes the huni sound. Okay? So the kalimitan po, if someone has asthma, they're either using inhalers kasi po salbutamol can be inhaled po, no, or Ventolin, or albuterol, pwede din po yun, ano? And then, pwede din po siyang i-nebulize. So, asthmatics frequently nebulize their cells or use inhalers. Ngayon po, there is the short-acting and there is the long-acting. Yung short-acting po for acute emergencies, long-acting for maintenance. And then, we have the inhaled steroids. So, wala siya talagang oral. Asthma is not orally treated. What's meaning of oral? Hindi po siya it's not antibiotic. Ang first line po talaga ng asthma is inhalers. So, my best advice, get another consult. Meron ho ba talaga kayong asthma? Or did asthma happen in relationship to something? Na pulmonya ba kayo? You can get asthma after pulmonya. You can get asthma after COVID. And then, the first line drug is really inhalers and avoiding po yung nakakahika po sa inyo. So, my best advice po, ma'am, is to check the diagnosis. Okay? Asthma ho ba talaga yan? And then, number 2 po, if you want to put what you drank para makita ko po, that would be very helpful. But ask your doctor po if you should nebulize yourself or you should use inhaled steroids and inhaled beta-2 agonist po. Yan ang tinatawag na salbutamol, albuterol, Ventolin, ganun po. Okay?
Oh
so
my
yung mga
God,
hinihika, maybe I should do a talk on asthma because it's one of my favorite diseases. It's very common. My mom had asthma, Benji has asthma, my tita had asthma. So, po talaga, bread and butter talaga yan ng mga pulmo. So, sige ma'am, patingin kayo ulit to make sure that you have indeed asthma.
Doktora, inuulan tayo ng question.
Okay lang, go.
Question na po tayo. Later ko na po ipipick up yung mga questions from the poster po. Or kung nanonood man po yung mga nagtanong po dun sa poster, Please write down your questions po dito para ma-flash po namin. From Miss Michelle Sunga, Doktora, humapdi ang sikmura ko po. 1 month na po, 1 month na po. Natatakot po ako mawala po, tapos babalik po.
Michelle, it sounds like pabalik-balik po yung sakit ng sikmura nyo, no? One of the things you should consider po talaga is gastritis. Patingin nyo po yun. Some people try muna with Maalox, Maalox, yung puti po, no? Trial. If it gets better, then that's it. Pero kung nagpe-persist po talaga, first of all, trial of Maalox, M-A-A-L-O-X, ano po. But wag kung matagal. If it's not getting better, you need to see the doctor. Number 2, try to eat your meals regularly. Nasa oras po yung pagkain. And then number 3 po, try to avoid po citrus foods, citrus drinks, at yung nakakaasim po ng tiyan na coffee is one of them. Soft drinks is another one. If all of this do not work, within 2 weeks, pa-check up na rin po kayo. Okay? Wag pong magtatagal na tinitiis, hindi rin po maganda yan.
From Miss Normaline Samonte sa Bandal, ano po ang gamot po sa pulmonary? Ano pong pulmonary, Miss Normaline?
Baka, baka sometimes people say this for TB. There are drug combinations po for TB and they're usually taken po for 6 months. I hope I'm answering this question properly. Ano po, pulmonary TB ho ba? Usually, the most common po is a 3 or 4 drug combination. Ayoko na kung banggit yung gamots kasi mahaba po and it's more confusing, ano? But if you do have TB, like I explained po dati, isa pa yan na dapat i-webinar yung TB niyan. Diyos ko, mas grabe pa yan sa COVID at laganap talaga sa Pilipinas, though we don't talk about it. We need to, dudura po kayo kasi we need to know po kung anong dapat na gamot na gagamitin. Kasi because people keep starting and stopping their gamots, parang nagiging nagiging resistant. There's resistant TB na ngayon. So we need to, kailangan po suriin yung yung dinura nyo po to find out po kung ano yung dapat na gamot for you. Okay, I hope I answered the question properly. Thank you po.
Okay, next po from Miss Loris Ann Panghilinan. Ano po ang usual cause ng left-sided headache?
Ma'am, wala naman po talagang side ang headache. Some people are prone to headaches. Kung talaga pong left-sided and it's only on the left side, then that's something that is concerning and you should see po a neurologist. Kasi po yung talagang forever left side, it's time to see somebody po, no? Pero general headache po, some people are really prone to headaches. Some people do get migraines. Sometimes people get headaches from not eating, from their sugar, from stress. Ang dami po talaga. But if it is persisting on the left side, please see a neurologist.
Okay, from Miss Weng Benig. Doktora, ask ko lang po, ano po ang gamot sa sakong na masakit, lalo na po kung tatayo po sa madaling araw na paggising. Salamat po.
Ano po ang sakong?
Dok, I think yung, alam niyo sa may foot sole, and then there's parang buto na pabilog sa may end ng foot sole.
Is it you mean at the heel? Ganun ba? It's your heel pain. The most common cause of heel pain is an arthritic spurs. Yung spurs po talaga and arthritis. Pag po yan, see a rheumatologist. You can try po muna yung mga paracetamol, ibabad po yung paa, ganun, masahe. If it's not getting better po, usually it is a heel spur. S-P-U-R. Kailangan po yung i-check up. Isa pa. What is the temperature of your room when you go to sleep? Ano? Kuminsan po talaga pag masyadong malamig, nagkakasakitan din po ang atin po mga buto and bones and joints. Ano? Heel spurs, related po yan to sa ilalim naman po ng paa, there's a fascia. Parang po yan, litid. Okay? That can get inflamed. Masakit din po yun. It's called plantar fasciitis. That's related din po with heel pain. who to see, a rheumatologist po or an ortho. Kuminsan po, yun po, no, there is ano po, calcium in our heels. I'm not an expert po sa bones. Bone and joint po yan, ortho or rheumatologist. Okay?
Okay, next question na po tayo, Doktora.
Yep.
From Ms. Marife Garcia, good PM po, Doktora. Anong mas okay na gamot para sa anak ko? Inuubo at hinog na yung ubo niya, Doktora. Pinapainom ko din siya ng oregano tea.
Ma'am, you know, I'm not a kid doctor po talaga eh. So I really hesitate to give opinions on, I don't even know, baka ho 3 months yung bata. Talagang wala akong karapatan. So ma'am, my best advice, please see a doctor po, no? If this is a baby, sometimes I try to nebulize. Pero kung talaga po nakikita nyo nahirapan huminga, it's time to see a doctor na rin po.
From Mines Miklat Castaneda, baka wala pa rin tea. Baka wala ka pa sa pagkain ng bawal kaya di bumababa. I think
Ay,
he is
naku, ma'am.
struggling
Yes.
po.
Naku, diniretso na nyo na po, no? Tinuldok nyo talaga yung problema. You know what? It is really difficult, ano, high blood pressure. Because aside from the gamots po, we really need to have a lifestyle change. Pag kayo po ay talagang nakatulan na po, no? High blood pressure, diabetes, just our actions po talaga can make a big difference on the control po of our blood pressure and our blood sugar. Kaya lang kuminsan talaga, no, I see people na, for example, no, first time pong pumunta, then 140/90, overweight, smoker, ganon. Sometimes, I like to give them the benefit of the doubt na magbabago po sila. So, I give them mga 2 months, Reina, along with an exercise, ano, what to do, no, lose 10 pounds, ganoon, modify your diet. And then, I will see them po in 2 months. And then, take your BP every week, every Monday, yung mga ganon ho, may monitoring. Ngayon, after 2 months, trial po, tingnan po natin ano po kung kaya po nila and what happened. Kung talagang it's still 140/90 or hindi pumayat or what, then we need to start medication. Kaso, if someone comes to your office, 180 na po over 100, yung mga ganon, wala na pong trial yan of weight loss, dire-diretso na pong gamot yun. Okay? So, yeah, yes, ma'am, it's really ano po talaga, once you get diagnosed with what we call lifestyle diseases, and yan ho, panghabang buhay na at matagalan, you really need to change your lifestyle. Kahit mahirap pa.
From Ms. Marites Briones, good evening po, Doktora. Ask ko lang po kung ilang % na pwede ka pang magka-pneumonia if vaccinated ka na ng anti-pneumonia.
That's a good question, ano? Let me tell you this, okay? The pneumonia vaccine and the flu vaccine are not 100%. I mean, people are mad because the COVID vaccine is not 100%. Pero yung mga bakuna po talaga, they give you a high percentage of safety, pero hindi po siya 100%. So what should you do? I think you should just eat wisely, live your life, and take the proper lang naman pong, syempre, mag-iingat, how do I put it? Yung sensible lang, okay? Yes, it's still possible to get pneumonia with an anti-pneumonia vaccine, but it is rarer. Ito pa, this I wanted to add. Sorry. I wanted to add lang, ano po. Because we are all wearing mask ngayon, no? Yung incidence po ng pneumonia, flu, and iba't iba pong ibang respiratory viruses like colds, Reina, bumaba. Ako nga, I haven't had a cold in 2 years. Kasi, colds, viruses, pulmonya, ano yan eh, respiratory lahat yan. Even TB siguro bumaba. Respiratory po talaga yan. So, if you are really wearing a mask, you're also protecting yourself from COVID and also from pneumonia po. And of course, maganda po na nagpabakuna po kayo.
From Miss Alice Baltazar, good PM po, Doktor. Ano pong vitamin sa lungs? Senior na po ako, hindi naman po ako inuubo.
Thanks for this question, Ma'am Alice. And ako po, no, if you notice and you follow me for some time, If you notice, Reina, I'm very conservative when giving vitamins or ano po, or medications. I really believe that the best health benefits po can be taken from our food, okay? If you eat properly with proper po proteins, small amount of proteins, either meat or fish, chicken, pwede rin po. Small amount of carbohydrates in terms of rice, maybe some bread, and then a large amount po of fruits and vegetables, that's more than enough na po. Pero, kung gusto niyo pong magpa-vitamina, you wanna take a vitamin, you can take one multivitamin, marami na po yun, marami na po yung laman. And the rest of that po is all marketing. Okay? So wala naman po talagang vitamin specific to the lung, but just your general good health po, exercise, proper sleeping, malaking bagay na yun, and one vitamin lang po. Okay? No need to waste your money po buying 5 to 10 kinds of vitamins. Nako, marketing lang po yan.
Okay. From Miss Michelle Sunga. Wait. Parang niresan niya lang po ito. Okay, from Miss Arlene Esquivel. Good afternoon po, Doktora. Praise be Jesus and Mary. Ano po kaya ang possible cause ng palaging mabilis na pulse rate? More than 100 po, madalas. At ano po ang pwedeng gawing remedy? Salamat po.
Thanks, Arlene. That's a very nice question po. And sometimes people do notice na mabilis po yung heart rate nila, no? It's usually between 80 to 100. Anything a little below 80, mga 70, especially for an athlete, it's okay, ano? Pero pag bumababa na rin po, it's of concern. Yung concern naman ni Ma'am Arlene is the high heart rate, no? Number one, how do you measure your heart rate? Okay, good question. Ganito, get your hand, no? Ito po, no? Kamay. Okay. I-ano nyo pong pag ganito, no? Dito po, no? Here. Or this is your thumb. Dito po sa ilalim. Yan. Here. Ganyan. Put your fingers. You will feel your pulse. Huwag nyo pong diinan. Ganyan lang. Dito po sa may thumb area sa baba. May, yan. Pa, 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 pa. Yan. Corresponding po yan sa tibok ng puso as it goes out of the arch of the aorta, bumababa po rito, no? So, dun po, no? That's where you get your pulse rate, okay? You can count it. Wala naman pong masama. If you are resting, you should take your pulse rate while resting. Hindi naman ho, after you climb the stairs of after your workout. Talaga mabilis yun, ano? But resting heart rate. So, kung talaga mabilis, number one, count it, no? 1 minute. Do not do the 15 seconds. Do the entire 1 minute po, no? Kung talagang mabilis, another question is, even ho ba? What is the meaning of even? Pak, 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 pak. Pag bumibilis po, pak, 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 pak. What I mean by uneven, pak, pak, pak. Pak, pak. Pak. Pak, 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 pak. So, yun po yun, ano? If it is uneven, that is usually atrial fibrillation. So, you need to see a cardiologist po for that. But, there are just people na talaga mabilis talaga yung heart rate. So, number one issue, what are you eating and what are you drinking? Okay. Drinking. Punta muna tayo sa drinking. Okay. Are you drinking coffee? Ay, doktora, I don't drink coffee. Okay, good. Are you drinking tea? Doktora, I don't drink tea. Mas mataas pa po ang caffeine sa ibang tea kesa sa coffee. Ano po? Number 3, soft drinks. Some people consume large amount of soft drinks. Marami pong caffeine. Caffeine po makes your heart rate go faster. And number 4, usually sa batang lalaki, energy drinks. Are you drinking energy drinks? Yung mga, I don't wanna name the brands kasi, pero alam nyo na ho yan. And then number 5, naku Diyos ko, sa mga babae naman po ito, na pag-usapan lang po, are you taking supplements to help you lose weight? Some of them can raise your metabolism and your heart rate. So, mabilis po yan. So, what are you eating? What are you drinking? Medications po. Nakakala mo supplements, yung pala, nagpapabilis na po ng tibok ng puso. Meron pong nasasaktan and this can actually be quite bad. Okay? So, what are you eating and drinking? So, yun na po, caffeine, dinaanan ko na po, no? Supplements, weight loss, yung mga nagbi-build up sa gym, please try to look kung ano rin po yun, ano? And then, another thing po, some diseases can cause fast heart rate, notably high thyroid metabolism. So, pa-check rin po ang inyong thyroid if you're having a fast heart rate. And then, number 3 po, of course, we have to have a checkup po with our cardiologist to see kung bakit po talaga. Kasi kung minsan, nininervous lang po. So, it would be good to document it po talaga with an EKG. What should you take? An EKG. At kung talaga kung you really feel na nangyayari po yun, it just didn't happen while you were in the doctor's office or in the EKG, they can put po a halter. Yun po yung 24 hours EKG. So, pwede po nilang makita yung tibok ng puso nyo po within 24 hours. So, usually, you can solve the problem po by stopping, stopping what certain foods and drinks that we might not know may can cause caffeine. Kung nagpe-persist, cardiologist po, EKG, and possibly halter.
Okay, next question po. From another Miss Arlene Guevara Gonzalez. Doktora, may skin allergy po ako. Okay lang po ba na uminom ng cetirizine at once a day po ito?
Ma'am, I'm not a dermatologist, but it is given po for allergies. So, if you drink it po under the supervision of a doctor, wala naman po sigurong masama. But again, I repeat, under the supervision of your doctor po. Okay, last question na po. We're approaching the 30-minute mark.
Okay, wag po magtampo yung ibang hindi nabasa. Pwede po tayong humabol sa another episode po ng...
Yeah, we keep doing this. Don't worry. Hindi po tayo nawawala ng episodes.
And Doktora, kung hindi man po nabasa yung kanilang question, abangan nyo po at mas maigi po na during live, dun po ninyo isend yung inyong mga tanong.
No, it's okay. Just send it anytime. Yes. If we can, we will pick it up.
Yes. Okay, from Miss Shirley Magsakay. With PM po, Doktora, yung mister ko po, pina-blood chem ko. Ang resulta po, bumaba po ang kanyang potassium. Ano ang dahilan ng pagbaba nun at ano po ang mainam na gamot? Salamat po.
Shirley, I cannot answer this question because there's many reasons po for lowering potassium. Sometimes it's the medication that you're taking, and is your husband a kidney patient? So, ako po, there are many reasons. Potassium is usually medication related. Pwede rin pong kidney problems. And again, there can be slight variations. It doesn't mean na may problema eh. Pwede naman pong paulit-ulit. Of course, if it is indeed very low, then ibang issue po yan. Okay, but sometimes we have small variations in our blood chem. We should not panic naman po. Pero kung talaga pong mababa, then you need to see po a nephrologist. Okay, so one last question.
From Ms. Rowena Tagalog de la Peña. Dok, tanong ko po, nagpa-test ako ng blood sugar 174 po. Tanong ko po, mataas na po ba yan or mayroon na akong diabetes? Ano po ang gamot dyan? Salamat po sa sagot.
Ay, ma'am, thank you so much. Let me just, one of the things that I should ask po is, how was this blood sugar taken? Okay, is this fasting blood sugar? Okay, how do you, okay, puntahan na lang natin how we diagnose diabetes. Okay, if you just take a random reading and 200, at matagal ka nang hindi kumain, fasting, you need to check with fasting blood sugar because likely diabetic ka na. But most of the blood chem and most of the tests that we do for diabetes po, fasting blood sugar less than fasting 8 hours po yan. If you're gonna take the fasting blood sugar, yung tinatawag po nating FBS, that is usually taken, the lab will tell you, wag na po kayong kumain after 8 o'clock and 6 o'clock in the morning, pumunta na po kayo dito to have your blood taken. Okay? So, assuming nag-fasting nga po kayo, you had a fasting blood sugar, anything higher po than 120, usually 126, ganun po, then you are diagnosed to be diabetic. Okay? 126 mg per dl po, no? Pag fasting blood sugar nyo is 100 to 125, pre-diabetic na po kayo. In other words, malapit na po kayo mag-diabetes and you need to do something about that. Less than 100 po is normal. So, yun po yun. Your blood sugar is 172. I am assuming po fasting po yun, ano? Kung ganun po, then if it is a fasting blood sugar, then you need to see na po your doctor. It is highly possible po na may diabetes po talaga kayo if that was a fasting blood sugar. Okay, what to do if you have a high fasting blood sugar? Okay, first thing, don't panic. Laganap na po talaga sa Pilipinas ito and it is very common. Number 2 advice po, no, do not panic. Why? It's common. And number 2, marami pa po tayong pwedeng gawin to help maintain your blood sugar. Okay. The doctor will assess po you, your family history, and your lifestyle. Okay. What's the meaning of you? Okay. Ikaw ba? What is your blood pressure? What is your weight? Ano po yung inyong trabaho? Number 4, are you active and exercising? Number 5, do you smoke? So lahat po yan kailangan po naming ayusin and to give you po the proper advices. And then number 6, how do you eat and what do you eat? Okay? So lahat po yan aayusin natin. From the lifestyle, no more smoking, kailangan mag-exercise, talagang magbabago po ang inyong lifestyle. But if you manage to do all of this po, you may even lower your blood pressure po without having to use medication. Ito po ang tinatawag po nating diet-controlled diabetes. And a lot of people lose 10 pounds and wala na po silang diabetes. So take hope po din talaga. It is possible to control your diabetes po without gamots. Pero kung talaga pong mataas, then that is the time to start oral medication. And kung talaga pong mataas, then that is the time to start insulin. Again, so that's you, no? Family history. Were your parents diabetic? Ako, my dad was an insulin dependent. My mom was a pre-diabetic and borderline na rin po, ano? So your family history will strongly also give us indications on what we should do regarding your case. And then, ano po, your family history and your lifestyle. Yun nga yung sinabi ko, your lifestyle talagang iimbestigahin po natin yan. But if your fasting is 172, yes, it is higher than 126. So considered na po kayong diabetic. And what should you do? See your doctor po to decide what's the best approach po sa inyo, kung magagamot po kayo or if you will try po lifestyle changes. But again, if you are diagnosed to be diabetic, this is not the end of the world. Don't panic. Don't start crying, sama loob. Hindi po. What you should do is work with your doctor po to have a healthier lifestyle and let's move on po yung mga gamot at iba po from that. But we start po sa pagbabago po ng atin pong lifestyle or pamumuhay. So I really like that question. I'm glad that I gave a few minutes more for that kasi talagang ang ganda nun topic, I've been diagnosed with diabetes. What is my first step? Okay? So thank you so much, everyone. Please follow us on YouTube, Dr. Ana York Bondoc. We do live kasi ang dami po talaga mga tanong. And we do have TikTok din po. TikTok Doc, Dr. Ana York Bondoc. Maraming salamat po. And again, I'm sorry for not answering everything pero lack of time po. Pero bumabalik-balik naman ho and we're gonna pick up more questions. All right? Thank you so much and good evening po.